Hey everyone, I'm John Lynn, the founder and chief editor of Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Colin Banas. He's Chief Medical Officer at DrFirst, and Drew Hunsinger, Head of Growth at DrFirst. Welcome, guys.
Hey, thanks for having us. It's always fun.
Yeah, great to have you here. Lots going on here at Health, lots to talk about. But before we dive in there, Colin, why don't you start us off? Tell us about yourself and DrFirst.
Oh, wow. So again, thanks for having us. Colin Banas, I'm the Chief Medical Officer for DrFirst. For those of you who don't know, it's a 25-year-old company that's been in the medication management business for 2+ decades. So really specializing in end-to-end medication journey on behalf of patients, providers, pharma, and pharmacies. Some pretty exciting times.
Yeah, that's awesome. Drew, tell us about yourself.
Yeah, Drew Hunsinger, Head of Growth at DrFirst. Been with the company for 16 years. Worked in our EHR team, have worked in our hospital and health system team, and I'm spending a lot of time now with life science sponsors.
That's awesome. Well, Drew, I mean, that's interesting, that background, having worked across so many areas with a lot of EHRs, and obviously DrFirst works with hundreds of EHR vendors across the industry. Yeah, what would you say is maybe the biggest resource allocation challenge you're seeing with these EHR leaders that are, in some cases struggling? There's a lot of regulation, there's a lot of burden on them right now. What are you seeing?
I think it can be really hard to keep up with innovation and regulatory compliance at the same time, right? That's the balancing act, and depending on the year and where you sit in a regulatory cycle, I think that percentage changes, right? I might have 80% for innovation one year and 20% regulatory, and then it just all of a sudden will flip-flop, right? So I think some of the challenges are making sure that you're able to innovate, making sure you're able to be competitive, and then in areas that specifically are getting more attention, that have greater challenges to be solved, that you're able to focus on those and make meaningful strides. It's not easy, and I think we see the range of responses to that in our customer base, and so it's always interesting to try and help.
Yeah, I bet. Colin, what else would you add? I mean, he's right. How do you balance doing innovation while still doing compliance, which you have to do?
Yeah, I mean, it's where do you want to spend your cycles, right? One of the things that in my former role leading a health system around this was regulatory compliance often takes up all of the oxygen in the room. And if there is an easy way to outsource that or to have someone share the burden in the form of a partnership, then you get some of those cycles back for the innovation. And right now, we are in a very important inflection point as it relates to innovation. I think you're about to see a lot of things around AI, around consumer or patient experience really skyrocket. And so I think that's where it's really important for a partner like DrFirst to say, well, you know what, we'll take a lot of that burden on. This is actually what we do for 2+ decades. We're really good at it. And so, you've reclaimed those cycles, and then over the course of developing that partnership, we can also help with the innovation.
Yeah.
So it's kind of a win-win-win.
That is interesting. I mean, everyone loves dealing with compliance, right? I'm just kidding. No, I mean, who doesn't want to outsource the compliance, right? So that they can focus on the innovation. That's a really interesting message. And I'd love to talk about medication management. Obviously, that's your sweet spot. You've done a lot of work in that area. Maybe you could start us off, Colin. How are EHR vendors thinking about medication management strategically? Is it still a compliance thing? Because we know certification requires this or whatever.
Yeah.
Or are they doing more to differentiate themselves when it comes to medication management?
They need to be. So I think I'm going to keep saying this term, inflection point, but the rise of consumerism, and I hate the term consumerism in healthcare. I mean, these are our patients. But
they're not choosing to consume generally.
It's true.
But we are seeing, it's almost as if over the course of years of frustration, they're getting more empowered now, or the expectation for empowerment exists because they're seeing similar superior experiences in all other areas, banking, aviation, retail shopping. It's all very patient consumer oriented, and so medication management or e-prescribing in general really shouldn't be thought of as just this check the box compliant. It needs to be more. It needs to be patient empowering. And it's actually one of the most critical things that we can do for our patients is pick the right therapy and then ensure that they get on and stay on the right therapy, because we've all seen what happens when you don't, in the form of readmissions, bounce backs, poor outcomes, even morbidity and mortality. And so it really is time to stop thinking of e-prescribing as a check the box phenomenon and start to look towards people who are innovating in that space, particularly on behalf of the patient.
Interesting.
Yeah, I think, if you rewind the tape a little bit and go back 15 years, e-prescribing was write a new prescription, send it to the pharmacy. There's a little bit of formulary guidance in there. Over the years, we've added real-time benefit, you've added prior authorization, there's PDMP workflows, controlled substance prescribing, right? So for a lot of these, for a lot of companies that have been in this space, what started as a pretty simple build with a few transactions and a little bit of regulatory work has ballooned over the years into a workflow that's used 70% of the time. Doctors leave or patients leave with a prescription. And it's one of the few workflows that have pharma as a stakeholder, pharmacy, payers, PBMs, patients, providers. They're all engaged in that slice of the EHR total workflow. And complexity is growing, but to Colin's point, I think we're at a point where technology is and can continue to streamline that.
Yeah. Well, and I love that you started talking about the patient and the impact to the patient of these EHR vendors implementing or not implementing certain functions and features, but the providers are impacted as well. Like, what are you hearing from EHR vendors about the provider experience around these medication workflows? And, what are some of the biggest pain points that are impacting provider satisfaction?
How much time do you have? Okay.
You're the provider, so go for it.
So, well, there's a couple of things that come to mind. First off, the explosion of specialty medications, right? So like in the last year, 90% of the new medications in the funnel were specialty meds. Specialty meds come with complex instructions for our patients, complex requirements for approval, and it's hard to keep up. Like, it really is,
It is.
It went from one GLP-1 to now there's, like 5 or 6 to choose from, and it's going to continue to grow. And they all have different requirements. This one can be filled here, but not there. This one needs a prior authorization. This one needs this code, and so as a provider, what I want is to get upstream of all that. I want you to help me do that correctly from the jump, because everything that I get correct up front is one less phone call, one less portal message, and more importantly, it's a patient who gets on therapy in a timely fashion. And therefore, I'm saving those cycles, and I'm, potentially preventing the bad outcomes.
Sure.
In a similar vein, the other thing on the provider experience is, how can I do this so efficiently so that I don't have to have my staff or have my team deal with the repercussions of getting it wrong, right? So, just like I said, I sent it to the wrong pharmacy, and I find out 3 days later, well, now I have to void that script, write a new script, contact the patient. Like, there is like 6 different steps in that. Whereas if we could have just get it right, or even better, like get it right in concert with the patient. Sure. Like, let's empower the patient so that we can do this together. And so, this is, as Drew said, it's so complex now. It's not just, amoxicillin 500 milligrams go.
And there's only one pharmacy in a rural area.
Well,
I have 10 options here.
If you think about it, a lot of the core, back to regulatory, a lot of the core certification requirements were made for retail drugs going to retail pharmacies.
That's interesting.
Right? And to Colin's point, that world is over, and even now within like the GLP-1 example, you can have commercial insurance, you can do cash pay program, you can do home delivery, right? Like the options for patients to afford that medication and to have it delivered to them, like those are expanding rapidly. And there's no possible way that a provider is going to remember each brand's nuances based on plan, based on what that pharmaceutical company launched in the past 2 weeks, because things are moving that fast. It has to be application logic that drives these things, so that the providers are just, through their normal workflow, guided towards the correct output.
That's so well said. It needs application logic because it's too complicated and moving too quickly.
And so we've invested over the past couple of years at kind of changing the paradigm from, hey, we're writing a retail drug to a retail pharmacy, check the box certification, to we need the ability to manage complex rules, right? Pharmacies can have rules, brands can have rules, patients can have rules, and you need to balance those and to the best of your ability align incentives, which is not easy in healthcare.
Sure.
But it keeps us busy, I'd say.
Yeah. I think the other interesting thing, I mean, just hearing you describe about the evolution of, okay, first it was just send a script electronically, right?
Yep.
We do that now.
We do.
Somewhat solved. But then, I think a lot of EHR vendors started there, and then they started adding on EPCS, prior authorizations, patient engagement, so on and so on, right? Like
it's incremental development, incremental investment. Each of them has its own regulatory burden too. It's
what
hard.
are you seeing out there in the industry for those that have kind of cobbled together, an EPCS solution, a patient engagement solution? What's the experience they have having these fragmented solutions, and what are the conversations you're having with EHR vendors around this integration?
Yeah, I mean, I think fragmentation leads to friction, right? And what you're really looking for is that seamless experience on behalf of all of the parties involved. And so I think that's one of the core advantages of DrFirst as a company, is that this end-to-end experience that we're able to offer to all of the key stakeholders in the medication journey. And so, yes, we got where we are today, through necessity. I mean, as Drew was saying, we cobbled these things together in an incremental fashion. But the exciting things we're working on now really is to flip the whole paradigm and to rethink this as less of a point-to-point sort of, I keep calling it ping pong, the way that we do prescriptions now, into something that is more dynamic, more collaborative with all of the parties involved.
Yeah, it's interesting too, right? Like if you just take the real-time benefit and EPA, just two of those transactions, those two are codependent in a way, right? The real-time benefit response is what tells you if you need a PA, and there are things even upstream of that you can do to improve it. So you really need to think of it as one continuous workflow versus I'm adding these different services on, and that's where we spend, I'd say, a lot of time and energy in making that seamless, because when they work in concert is when the friction is avoided, to Colin's point.
I mean, let's talk more about that as you kind of look to the future, right? Like there's regulatory pressure, it's changing constantly, as fast as any government regulation can change, I think. It's moving, and we're getting new ones all the time. Technology is evolving in healthcare. We're seeing that, starting with AI now, right? What advice would you give to EHR vendors as they kind of approach medication management and everything that goes beyond just the e-prescribing, so that they're prepared for what's coming next from a regulatory standpoint, but also from a provider/patient expectation standpoint?
So there it was right there, the patient expectation.
Yeah.
And this is such an important time, because it feels like, whether it's through frustration, whether it's through education, whether through experience, patients are expecting better. They are expecting more. They are expecting a better experience across the board. And so you're going to start to look to EHR vendors to say, how can I provide that experience? Not only vendors, but also companies like ourselves, partners. How can we provide that experience to really empower the patient? And actually, I think that pressure is probably more important than any regulation. The regulatory cycle just takes so long, and it is necessary evil to some extent, but the pressure from the consumer, and again, I hate that term, but the pressure from the consumer and the expectations is really what's driving the change, in my opinion, for what we're seeing right now.
Interesting. What would you add, Drew?
Yeah, I think from a business perspective, you need to try and future-proof your business, right? So regulatory cycles come every couple of years. That's pretty constant. I think we're in a period now of, I'd say, rapid market dynamic shifting that are not regulatory, right? And it's what Colin's saying. It's what are patients expecting? What are providers expecting? New policies and new different models for getting medications in the hands of patients are, changing almost on a weekly basis, I feel right now. So the business goal needs to be, okay, how do I make sure that the workflows are good for providers? How do I help the providers meet the needs of the patients and have functionality and capabilities that they're have come to expect, I would say. And then, make sure that whatever decision I make, whether that's build in-house, partner, that decision has a 5-year time horizon on it, because this is going to continue to happen. And I think the pace of change will continue to increase, which is part exciting and part scary, because it's
you're a product manager.
You need to try and see around the corner in terms of how you architect systems, how you build APIs, how you set yourself up to be flexible for something you can't necessarily see yet. And so it's a bit of a art form as well as science.
It kind of reminds me of CIOs. CIOs used to be in the data center business, to be frank, because the pipes weren't good enough.
Wires and fibers.
So we needed the data centers. I don't know a single CIO now who wants to be in the data center business.
Nope.
They're like, that's a commodity. The data centers in the cloud are innovating much quicker than us, and it's and that's a commodity that doesn't enhance what I'm doing. I might as well let them innovate it. And it feels like EHRs are in a similar state in some degree, right? Because there's there's a lot of other innovation I could work on.
Yeah.
Where do I want to focus my time?
And you got to look at the entire. We are fortunate in that we can focus on a specific slice of that workflow, right? And go really deep, spend our time and resources in building that out. But they've got charting, they've got RCM, they've got intake, they've got different marketing engines, right? It's one small slice of their total responsibility, and I think it's very hard to do all things very well.
Yeah.
And that's kind of our business model at the highest level.
Yeah.
No, I appreciate you guys taking time out of your busy schedules here at Health to come and chat with us and share about your experience and where medication management and other innovation and compliance is going. So thanks so much for talking with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, guys.
Thanks, Joe.
Thank you.